All right, so today we are working with FA, who fell and fractured her humerus 3 days ago. She underwent an ORIF and the fracture is now stable. OT is going to be working with her to complete all of her upper extremity goals. When she had her MRI, it showed that she had small infarcts bilaterally in her cerebellum. So we will be addressing her balance and gait goals. Prior to her stroke and fall, she was independent in all ADLs, including driving. We're working with her in an outpatient setting at the skilled nursing facility she's currently at to prepare her to go home. The goals that we are working towards is increasing her bilateral ankle dorsiflexion to plus 10 degrees when she's currently at 0, and ambulating over level surfaces to 150 feet with a single point cane independently. How are you doing today?
Hi.
I'm Taylor. I'm going to be your student physical therapist assistant that's working with you today. So before we get started, can I just get your name and date of birth real quick?
My name is FA. My date of birth is 6/29/35.
Awesome, perfect. So how are you feeling? Any pain?
Well, a little bit. I had a fall, so I had to get my arm worked on here. Balance hasn't been really good since my stroke. My confidence is down a little bit, especially at nighttime.
Yeah, we're definitely going to be working on getting your walking and your balance back to where it was before, or as close to where you were before as we can. As far as walking at night, we have a couple of different options. We can talk to the nursing staff about adding in some night lights to your room, or possibly leaving the light on in the bathroom and with the door cracks that you can still see. Or another option is always, hit your call button and get a nurse to come in and help you before you stand up. She can turn the lights on and everything that you can't do from the bed. So you can definitely talk to them about that. So today we're going to be working on your strength in your ankles and in your hips. So I'm going to go ahead and get a couple of measurements of how much movement you have in your ankles and how strong your hips are. Is that okay? Okay. Let me just grab this real quick. All right, before we get started, let me just make sure that your bed's locked. Yep, looking good there. All right, I'm going to raise you up just a little bit. You can put your hand on the table for some support if you need to. Okay, we're just going to slide your shoes off really fast. Okay. I'm just going to feel for a couple of spots on your leg if that's all right. Okay, go ahead and push your foot up as much as you can. Oops, let me do that one more time. Okay. So we've gotten a little bit of movement back. We've got about 1 degree there. It's better than the 0 you had last time. Okay, and push your foot up. Push, push, push as much as you can. Okay. Yep, and we're still at 0 there, but we're definitely going to work on that. So let me go ahead and lower you back down. Slide your shoes on. Okay, so now I'm going to test the strength in your hips. Normally I would do this with you on your stomach, but I know we can't lay on that arm right now, so I can just get you to lay on your back. There we go. Okay, I'm going to raise you up a little bit. You feeling okay? Okay. So I'm just going to lift your leg up a little bit. Keep your leg fully straight, that knee locked in. Okay. Now I'm going to try and lift your leg up. I want you to try and push it back down into the table, okay? Right, push. Hold, 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 hold. All right. Let's do the same thing on this way. Keep your knees straight. All right, I'm going to pull you up. Push me down. Okay, push, hold, 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 hold. All right. Yep, so you're looking still about that 3+ that you were last time. So I'm going to go ahead and lower you down. We can go ahead and stand up real quick, or sit back up. Okay, so the next thing that we're going to do, we're going to go ahead and stand up, and we're going to see how long you can hold your balance for. So I'm going to go ahead and put my gait belt on. Do you remember this from your evaluation? Okay, so you remember it's just something that's gonna help me keep you safe at all times. Is it okay if I put it on you? Okay. Remember, it's gonna be snug, but it's not gonna be uncomfortable. We're gonna go right underneath of that arm so we don't hurt it. Okay, for this exercise, we don't get to use your cane. We're just gonna stand up, and I want you to cross your other arm over top, and we're just gonna stand with our feet together, okay? So whenever you're ready, go ahead and stand up. Okay, and you can take a little step away if you need to. Put your feet as close together, cross your arm over top. All right, and then I want you to just stand here for as long as you can, okay? You feeling okay? All right. All right, awesome. You were able to do that for 30 seconds. So now this next one's gonna be a little bit harder. I want you to close your eyes for me and see how long you can do that. Oh, go okay. Go ahead and open them. And you can go ahead and sit back down. So that was a little bit better. We were able to get about 17 seconds with your eyes closed, which is an improvement from the 15 that we had last time. So the next thing that we're gonna do, we're gonna be standing up as well. And I'm gonna raise the table up so we can either use that for support or your cane. We're gonna put your foot into what this is called a TheraBand, and it's just gonna give you a little bit of resistance. We're gonna do what's called hip four-way. So when we're facing the table, you wanna pull your foot back. And we're face this wall, you're gonna put it behind you and to the side. When we face the windows, we're gonna kick it straight out in front of you. And then when we face this wall, we're just gonna go straight out to the side. So this is all of the motions that the hip does. We're gonna do it on both legs. We're gonna do each kick 15 times, and then we're gonna do the whole thing 3 times. Does that make sense? All right, so whenever you're ready, go ahead and stand back up. Oh, let me get you your cane. There we go. Go ahead and stand up. Okay, so let's come over this way. Okay, so you feeling okay? All right, so go ahead and pick your foot up. I'm just gonna slide this band right underneath of it. All right, so you can either use your cane or use the table, but since we're facing it, we're gonna go ahead and just kick straight back. 1, 14, 15, okay. Go ahead and face this way. Kick it out like you're trying to kick me, behind you and to the side. 1, 14, 15. Face the front. Kick it straight out in front of you. 1, 14, 15. Okay, let's go ahead and turn this way. Okay, now straight up towards the side again. 1, 14, 15. All right, awesome. You are doing perfectly well with that. So we're just gonna give a little bit of a break. You've done 2 sets already on both legs. So we're just gonna go ahead and finish off this last third set, okay? All right, so go ahead and kick it straight out to the side. 1, 14, 15. Still feeling okay? Go ahead and face this way. Kick it straight out back. 1, 14, 15. Let's go ahead and face the side again. Okay, so this one, remember, it's like you're kicking me. So go pull that leg behind you into the side. 1, 14, 15. All right, and then go ahead and face the windows again. This is gonna be our last one. So kick it straight out in front of you. 1, 14, 15. Awesome, how are you feeling?
Good.
All right, so we're just gonna go ahead and lower the bed back down. That way you can sit on it. Don't go anywhere yet. All right, because I gotta take your leg out. I don't want you to accidentally trip. So go ahead and pick your foot back up. All right, so we can come back over here and have a seat. All right, so you did awesome. How are you feeling so far?
Good, a little tired.
A little tired? Okay, well, we are just getting started. We got a couple of more things for you to do today, okay?
Okay.
All right.
All right, Mrs. A. We're going to keep going with your exercises.
All right.
A few of them, they're pretty easy. I'll show you how to do them. For the first one, we got this Eric's mat right here.
Okay.
For balance. What we're going to have you do, real simple, just step right up on it. We're just just going to try to, because it's a little uneven, so we're just going to try to stand there and really build your stabilizers and work on your balance, okay?
Okay.
All right, we're going to do this 3 times. We're going to do it 30 seconds each. I'll be right there next to you the whole time. Should be an issue. All right. Sit that right there and go ahead and grab your cane. Whenever you're ready, you can come on up here. Step on up. All right. Feeling okay?
Feeling good.
All right. We're going. Set arm. Okay. All right. You can step on back. All right, we'll sit you down, let you rest for a moment. How's that arm feeling?
Feeling good.
Okay. How are your legs?
Whew, a little shaky.
All right. So, you ready to go for the next one?
Yep, we took a good little break there.
Okay. Come on up. All right. Get you stable. Go ahead and reset. All right. You're doing great. You have about 5 more seconds. 3, 2, 1. All right. Okay, we got one more set. You up for it?
Yep, let's go ahead and do this.
Okay. Go ahead. You're ready? There you go. Start one last time. You're doing great. How you feeling?
Oh, getting a little tired.
What's
We
the
can
last
do
set?
it.
The last set. Okay. Come on back. All right. Excellent. Go ahead and have a seat here. So you're all right. Rest. And I'll show you how to do the next one. This one's going to be real easy. We're just gonna, it's called heel drops. We're gonna use the staircase right here. Utilize this railing real well. Give you good support. Just gonna step on up here. Slide your feet back. You're gonna drop your heels down. Get you a good stretch there on the back side. Then we're gonna come on up and engage those muscles and come up to your toes, okay?
Okay.
This is gonna give you a good stretch back here as well as strengthen. So, all right, you up for that?
We'll try it.
Okay. Are you ready? Sure, you can grab that railing. Go. All right, so like I said before, you can come on back. All right, drop them heels down. You'll feel my foot up underneath. See, right here. Come on up to your toes. Okay, that's 1. We're going to do it 10 times. 2, 3. How you feeling?
Good.
Okay. 4, 9. One more. 10. Okay. How you feeling? You need to rest?
Oh, yeah, just a little bit.
Okay. You don't need to sit down or anything?
No, we're good.
Okay. Excellent. Whenever you're ready, I'm right here. One, 2, 3, 8, 2 more, 9, and 10. Great job. Okay. Feeling okay?
Yeah.
All right, we got one more set. Good to go. All right. 1, 2, 3, 8, 2 more, 9, and 10. Great job. Okay, you can go ahead and turn this way and grab this railing. All right. Step on down. here. All right, go have a seat, take a break. I'll show you what we got to do next. We got one more.
Okay.
All right. This one's gonna be real easy. You can see down there we have that chair.
Mm-hmm.
All right. All we're gonna do is we're gonna walk to that chair, and then you can rest right there.
Okay.
And as we're walking, I'm gonna be right next to you, holding you. I'm gonna have you look left and right. Really practice on scanning your environment and walk while you're walking. Just make sure you don't trip on anything. You know what's coming at you, or it might be in your way. All right. So whenever you're ready, just let me know, and we'll start walking on down there.
Okay.
Okay. Forward. Go ahead and look left for me. Try to stay as straight as possible. All right, look straight. All right, back on line. Now look right. Try to stay straight. All right, look straight for me. Back on line. Look left one more time. All right, get the chair. Okay. Go ahead and rest right there. How's everything?
We're doing it.
All right, arm okay?
Arm's okay.
All right, trying to avoid it, but still hold on to you. All right, so whenever you're ready, we can head on back down there. We're gonna do the same exact thing. We're just gonna go right back down there at that chair and rest.
Okay.
All right, good. All right. Look right for me. All right, stay nice and straight. Look left. All right. Then look straight for me. Let's try to get back on line. All right, good. Now look right. Very nice. Okay. Look left. And look straight. We are back to the chair. Sit down. Okay. How you feeling?
Tired. We got one more, right?
One more. This one's gonna be a little bit different. We're going just right here to this chair. If you're tired, we can sit there, but we're just gonna, it's the halfway point, turn around and come back. So we don't have to go all the way down there and come all the way back.
Okay.
Whenever you're ready. All right. You look right for me. All right, look straight. All right, go ahead and look left. Okay. So turn around right here. Whichever way you want. Okay, you good to make it back?
We can make it.
All right, go ahead and walk for me. And look left. All right, look right. And you go ahead and look straight. Sit you down here. All right, you did great. How you feeling?
Tired.
All right, well, you just rest there. What we're gonna do now is we're gonna go over your home exercise program.
Okay.
So I have this handout here for you, which will kind of show you everything I'm about to show you now. Right there.
Okay.
Okay, I'm gonna walk through it right now and just show you. But you have that for you, take home, and reference whenever you get confused or maybe forget something. All right. So, now we're done with your exercise. I can go ahead and take this gait belt off you. Okay. Set it on. We're actually going to utilize this. I can show you one of the exercises in the first one I show you.
Mm-hmm.
What it is, it's just going to be a calf stretch. Do it seated in your seat at home, anywhere. Just want to be able to get that leg as straight as possible.
Mm-hmm.
Take a strap. You can use a towel. Really anything, a belt. You can get it around there. You just want to put it around your toes right here. All you're going to do is straighten that leg and you want to pull back. And so it's going to do is stretch your calf out because we're trying to increase that dorsiflexion like we talked about earlier.
Okay.
And that's that point your toes up towards the sky. Okay, so we're going to do that. It's going to be 30-second holds. You're going to hit it 3 times. And just one nice good hold. You don't want to overdo it. Just a nice solid stretch, but very comfortable still. And the next one, you can also do just seated right there. It's going to be four-way ankle, is what it's called. So pretty much you're just going to move your ankle in different directions, and this band's going to apply a little bit of resistance towards it so you can build some more strength. It's going to be 4 different ways like this, that, back, down. So just put it around there. Okay, first one really easy. Just going to do ankle pumps, straight forward. All right. That make sense to you? That's good? All right, so the next one is a little tricky. Make sure you're nice and stable wherever you are though. And you're gonna just push out like that, across. And you can just turn. You're gonna turn your whole foot towards your big toe like that. All right, those just work, everything to stabilize your stance and work on your balance. Next one, I'm just gonna step right on the band, go straight out. You're gonna turn outward. Just turn your whole foot towards that pinky toe. Just like that. And then the last one you can do from that same position. You're going to be going back like this. And that's going to work those dorsiflexions we talked about, how you're going to bring your toe towards you, towards the sky. All right? Does that all make sense to you?
Yep.
All right, awesome. And last but not least, when doing this one, it's called mini squats. Make sure you have a family member or someone there with you. Make sure you're safe at all times. Safety is the most important part of all this. It's just you're going to find any surface. Recommended a counter because the counter is usually very steady. And just you want to balance yourself real nice. Just do little mini squats. You don't want to go too low. You don't want to get off balance, but you still want to engage and work the muscles so we can build that strength back.
Okay.
Okay. And I believe that's just about everything. You have your cane with you for any safety. Always make sure it's set at a proper height. Safety is always an issue, so like I said, make sure when you're get up and moving around, have someone with you to make sure you don't fall. Okay. So you feeling good about today?
Feeling good.
All right. Home exercise plan makes sense.
I think so.
All right. Awesome. Okay, we'll get you ready to get on out of here, and you have a great day.
All right. I'll see you tomorrow.
Yes, of course.
Okay.
All right. You have a good one.